Lieutenant Governor Rutherford, you're chairing the emergency task force to look at the heroin overdose emergency. When do you expect to have recommendations?
We will have initial recommendations and a report this summer, August, and the final recommendations going to the governor December 1st.
Can you give us a headline? Is something emerging that seems
Well,
an obvious step to take?
Well, there are a number of consistent themes that come across. First of all, there are a lot of families and individuals who are struggling with this ailment. One of the things that we have found out through some of the federal authorities is 75 to 80% of the new heroin users are coming off of prescription medications. So that has a lot to do with the surge. So there's some steps that possibly can be taken to better inform doctors, dentists, pharmacists in terms of the impact of these prescription medications, as well as the public in terms of how they will utilize these medications. There is a need for treatment facilities. There's questions in terms of how to approach that, and that's what we're exploring now. There's a law enforcement component to this, but as all of the law enforcement officials, both actually on the street police officers and sheriffs, but the state's attorneys will tell you we're not going to arrest our way out of this, and it's not helpful to go after the users, those who are addicted, and even the small-time dealer that essentially is dealing to supplement their addiction. There's a question in terms of interdiction, which is much more of a federal issue, but we're coordinating with federal officials. So it's a multifaceted approach and challenge. Prevention is the key, though. We need to increase the education aspect. In high school health classes, they get information about drug abuse, but we need to start earlier, probably as early as late elementary school on to middle school. So there's a number of issues, and we're trying to take a holistic approach to addressing the challenge.